Welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. I am delighted to introduce today's guest, Dr. Nalini Chilkov, creator of OutSmart Cancer System and founder of Integrative Cancer Answers, an online resource for patients and families whose lives have been touched by cancer. She is the author of the best-selling book, 32 Ways to Outsmart Cancer, How to Create a Body Where Cancer Cannot Thrive. Dr. Chilkov is recognized as an expert in integrative cancer care and immune enhancement, and is one of the top 10 online experts in breast cancer. She brings over 35 years of experience with thousands of patients to our discussion today. Welcome, Dr. Nalini.
Thank you so much for having me.
What a privilege. It's been so great reviewing your work and the resources that your team provided to get ready for today. And I'm so glad that you exist and do what you do and make preventing cancer and treating cancer something that's doable and life-affirming, as opposed to intimidating and overwhelming. I suppose those are the main phrases that went through my head as I got ready. So could you tell us a little about yourself and your OutSmart Cancer System and how you came to specialize in integrative cancer care?
Absolutely. But, I think I'll just respond to something you said before I tell my story, which is the overwhelming nature of being diagnosed with cancer. And so on the first visit, my goal is that a patient walks out the door or out of the telemedicine session less anxious than at the beginning, and with a sense of control and agency over what is going to be their trajectory and their path before them. I think it's really important to decrease that overwhelm and anxiety, because it's very hard to make big life decisions in the middle of anxiety and a lot of new information. So I thought I'd just respond to your comment, and then I'll talk about myself then.
Right. Well, it's so cool when I was looking at your materials that your first message is, hey, we're going to give you a health plan. You're going to be able to respond to this. You're going to be an outlier.
Yes.
That's just that sense of them having that relief just some of the pressure coming off immediately has got to.
Well, two things. One is I just say, just by walking in my door, just by scheduling with me, you're already an outlier, because you're thinking about what else you can do besides standard of care oncology. And I also say to patients, you need a team. You need disease experts. You need your oncology team. You may need a surgeon. You may need a radiologist, but you also need a health team. You need a health experts on your team. If your endpoint is going to be health, you need a plan for health. And, the word health isn't even in the lexicon in an oncology office. So we have to bring it into the conversation. And I also feel that patients do better when they have collaborative teams who talk to each other as well. Right. So one of my sort of lifelong models is to call up the oncologist or the surgeon or the radiologist, introduce myself, say, I'm here to support a good outcome for our patient, and to encourage them to be interested in what else the patient is doing, reassure the oncologist or the surgeon that I'm not going to interfere with or mess up anything they're doing. I'm aware of interactions and contraindications, and I assure the patient of that. And then patients sometimes hit up on physicians, oncologists, say, you can't do anything, you can't do anything except what I tell you to do. And then that takes away the whole health model, but it takes away the patient being the head of the team, which I think is really important. So not only do I say you have a team, I say we all work for you and you are the head of the team. Nobody can schedule anything without your permission. Nobody can administer anything to you without your permission. You get to decide. You get to decide the pace. You get to decide if you have enough information to be comfortable with what's next. And so I think that's like a part of the conversation right at the beginning. And some people's personalities are naturally like that, and some people really aren't. And then, people who are older than baby boomers will tend to give all the authority to the doctor. And that is the demographic of a lot of cancer patients, to be older. Now baby boomers fall in that demographic as well, over 50, over 60. But, I started out, everyone has a personal story. And I started out getting really interested in cancer because both of my parents were diagnosed with cancer in their 50s.
Mm.
And so the good news, I'll just go to the end of that story. Neither of them died of cancer. My mom died at 88. My dad died at 90, and they both died of cardiovascular disease and not cancer. So, you can have cancer and go on with your life also.
Yeah.
And so a lot of patients really hear it as a death sentence. And there are cancers. There's not just one cancer. There are many, many diseases that fall under that umbrella. Even if you have breast cancer, there are many breast cancers. And then that disease is happening in a unique physiology biosystem with unique life history, health history, and genetics and stressors. And so really every single patient is unique. And in functional medicine, we understand that the treatment plan and the recommendations are for that one person based on what is unique to them. So I try to bring that in and also educate patients about choices their oncologist may not have offered to them. And especially some types of evaluations that are not standard of care that can help to individualize the case, but also understanding we want to pay attention to the whole biosystem, that the oncologist is fascinated by the tumor or the cancer cells, but not fascinated with how they got there, not fascinated with toxic exposures, not fascinated with their genetics or their biology. And so, what if you're diabetic and you have cancer? What if you have autoimmune disease and you have cancer? So all those things matter.
As I reviewed your concepts, it reminds me of an interview I did with Dr. Catherine Clinton, who's a naturopathic doctor in Oregon, about terrain theory and how we look at where this is happening, in this case, the body, as opposed to the what focus of the oncologist. And the two pair beautifully. It's such a great example of functional medicine saying the oncologist attends to that sort of tactical decision making about the tumor size and staging, and then the functional medicine team says, let's attend to the garden. I know I'm mixing metaphors now, but that's another one of
the soil.
The soil. Yeah. I thought it was such a great metaphor.
Well, it is. And in naturopathic oncology and integrative oncology, we actually explain to the patient that we're dealing with the cancer terrain, which in medical lingo is the tumor microenvironment. It's this signaling environment. And I tell the story of the soil in the garden to patients to have them understand how important the terrain is. And then we actually do blood tests that look at biomarkers that help us to understand that complex environment so that we can see if there are any other factors contributing to a body that is permissive of and supportive of developing cancer, because we want to have long-term thinking. I mean, all physicians want the best outcome for their patients, but oncologists don't have really long-term thinking. They're like, how do we get you through this episode of cancer? And they don't even have a recovery plan for after you finish treatment. They just say, bye, we're done. We hope you don't get a recurrence. And so, it's really important for the patient at that time. They've had all this high touch and interaction with their team, their oncology team, and then it's done. And they're like, what now? And so the fact that we're there to carry them through that and really say, okay, now the conversation is not about disease. Now the conversation is about health. And psychologically, that's really important to the patient, to reframe that.
I think some of them who come to our offices intuit it. So they're the first to the party, and sometimes the conventional doctors are the last to the party. And other times it's the first piece of good news they receive, that the terrain has multifold, shocking, beautiful, wonderful, amazing news about changing the experience and the outcomes.
Yes. And so, patients then get this sense that they are going to influence the trajectory going forward. And the oncologist, contrary to that, kind of disenfranchises and disempowers the patient and says, okay, next week we're going to start neoadjuvant chemotherapy, and after that we'll do surgery, and then after that we'll do more chemo, and then we'll do radiation, and then we'll put you on hormone therapy. And the patient is like, what? And they don't even know what all those things are. And their psyche isn't ready next week. And maybe they want a second opinion. Maybe they need to get their kids situated. Maybe they need to deal with their own emotions about this diagnosis. Maybe they want to get other opinions. And so we also say a cancer diagnosis is not an emergency or urgent care diagnosis. Cancer is a marathon, not a sprint. It's a long process. And also, most people aren't going to die of their cancer. And so I actually tell them that, because the oncologist never says that. And that's like looming in the foreground for the patient and the patient's family. And so, one of my colleagues is one of the top breast surgeons in LA, Dr. Christy Funk, and she always says to her patients, well, if you get breast cancer, you should just expect to live. And so, somebody's got to say that to the patient,
Yeah. It's so important to unburden folks. Some of the fatalistic messages, I think, are kind of leftovers from before all of our understanding had unfolded into this better understanding of how good people's prognosis is. And one sort of word I've heard you invoke in preparing for today, I wanted to add to this segue, is agency, because I love it that you promote agency of patients. And I think we've got really good data that does great things to the immune system, and it also calms down stress-distress centers that can get in the way of healing.
So, helping someone calm down gives them that clarity of mind to make decisions, and also a sense of agency that they have some control. And the oncologist is not interested in that. So we have to really give that back to the patient.
Yeah, absolutely. Well, what more should we know about your OutSmart Cancer system in terms of why it's so important?
So I got interested because of my parents, and they recovered from their cancers. My dad ended up having prostate cancer as a chronic illness, but at such a low level, he never died of it. And so that's a subset of patients who have cancer as a chronic illness, who really need a lot of long-term health support, because cancer itself has side effects, and then long-term treatments have side effects, and cancer patients have unique nutritional needs. And so the OutSmart Cancer system is really a way to help a patient understand how to create a body where cancer cannot thrive. Like, that's the goal. We don't want to be a host for these types of cells. And so we want to understand the cancer terrain, and we want to understand the unique needs of a cancer patient at every phase of their journey. And we want to attend to other things, lifestyle influences like sleep and exercise and food, that influence that terrain and the immune response and the stress response. And, patients are often really surprised that they can feel pretty well while they're going through their treatments. And because I think, a lot of media and movies and things make patients think it's like a Frankenstein experience, but it actually isn't. And so we reassure patients, these therapies are done very skillfully now, and you're going to do well, and you're going to not get an infection, and you're not going to be vomiting all day. And the picture the patient has really needs to be reframed. And also the oncology team doesn't do that. So it's really important, and to let patients know that all the side effects can be managed and minimized, or not have them. In fact, in my practice, a lot of patients don't suffer the expected side effects, or have them in a very mild way. And so they're very manageable. And so that's really important to the patient. And so the OutSmart Cancer system has its fundamental focus on the terrain and on health and on individualizing. which is what functional medicine is. And I'm trained both in Western medicine. I was a nurse in a past lifetime and a cell biologist, and also in naturopathic and Chinese medicine. So the naturopathic and Chinese models have all these poetic, beautiful metaphors for patients. And so we often tell stories about health using nature metaphors for patients, like the soil in the garden and the seasons. How long does it take for nature to make a change? You know, usually at least one season. And so people aren't impatient, because Western medicine, you take a drug, your symptoms change. Doesn't mean anything else changed, but your symptoms change. And so patients get impatient about progress and say, you know, the rhythm of nature is how we're going to proceed, and then we will have a durable outcome. And so it's really teaching a patient a new paradigm, a new framework, and also kind of slowing people down into the rhythm of nature, you know, and getting some attunement and embodiment and connection to, am I hungry? Am I thirsty? You know, do I need to move? And so those very basic things. I have a nutritionist that works with my patients and implements our OutSmart Cancer diet, which is basically a diet that influences the behavior of tumor cells and promotes healthy function. So one of those basic principles is to eat a low carbohydrate diet, because tumor cells are really get growth signals primarily from insulin when your blood sugar is high. And a lot of people think sugar is the issue, but it's actually insulin is the growth factor. And so if we eat a diet that lowers insulin, then we take away a big growth signal. So for example, breast cancer cells have more insulin receptors, more GLUT4 receptors, more insulin-like growth factor receptors on their surface. So they're very sensitive to changes in insulin and in blood sugar. And cancer cells have a different metabolism also. They prefer sugar as they prefer glycolysis as their main way to make their own energy, which is pretty inefficient. So cancer cells are vulnerable in ways that healthy cells are not because of that. And cancer cells also kind of co-opt normal physiologic functions for their own survival. So if we understand that, then we put them in an environment where they can't do that, then the cancer cell is more vulnerable to toxic treatments, right? And so, you know, we sometimes, if you have a big tumor mass, you do need to do some kind of invasive or toxic treatment, because natural medicine doesn't do that. And so people come in thinking natural medicine is a substitute for oncology care. It is not. And so people are disappointed by that. But natural medicine does not have the cell killing, cytotoxic aggressiveness and efficiency that the standard of care, chemotherapy and radiotherapy have. And so if we need that, we should use it, because the first job is to reduce your tumor burden. So we sort of explain the process to patients and why the choice is a good choice. You know?
I'm glad you mentioned that. I've found that it's a litmus test for which patients I can work with successfully on their cancer and their integrative cancer referrals to let them know that there isn't a substitute for surgery or tumor shrinkage, but that if they can embrace that intellectually and spiritually or pragmatically, whatever it is for them, then the yang of functional medicine is an incredible complement to the yin of getting the tumor burden reduced. And they have such great outcomes. They do get their heads and hearts around it.
You know, and there's lots of decisions patients need to make. So it's good to have someone with like their feet in both worlds to actually say, okay, this is the rationale for the surgery or the radiation. You know, you had a big tumor mass, so that's why we need to go here. And natural medicine is not going to take care of that. But once we reduce your tumor burden, then we can use natural medicine. So the goal is to get to microscopic disease. And so what oncologists also don't tell patients is, when you've had successful treatment and when the oncologist says you're in remission, you still have microscopic cancer cells. But the oncologist doesn't tell the patient that. But I tell them not to frighten them, but to say, we need to stay engaged. If we take control of those microscopic cells, they'll never do anything. And so we can use natural medicine when the scale is microscopic like that.
By creating that terrain, which is just not a support terrain for those cells. They are heartily discouraged from misbehaving in the terrain that you help folks create.
Yes, and then with some patients who have a very high risk of recurrence, let's say ovarian cancer is an example of a cancer that recurs and recurs and recurs and recurs and can be very aggressive. Then in those patients, we not only keep monitoring and managing the cancer terrain and overall health of the patient, but a few times a year, we do naturopathic therapies that are cytotoxic to kill and scavenge that small amount of cells so that we have a plan for that too. And we're not just waiting for a tumor mass to show up, which is what the oncologist is doing. So the oncologist is looking at more the macroscopic, with a tumor marker rises or there's something on a scan, then the smallest size you can see on the scan is 3 millimeters. Well, that's the size of a head of a pin, and that's 1 billion cells. That's too late, right? That's 1 billion cells. So, you know, we continue the monitoring, and then for patients with higher risk of recurrence, then I like to do every 4 to 6 months, 2 or 3 times a year, a protocol that lasts anywhere from 2 weeks to a month with, say, high-dose IV vitamin C, mistletoe therapy, hyperbaric oxygen therapy, and then oral cytotoxic herbs, which you can't take long-term, but you can take short-term. So I approach that way, so we're not failing to address that. You know?
I just find this so elegant, how attuned. It's no surprise given your number of years of expertise, but it's so beautifully attuned to the needs of each situation, which to me, the most elegant and effective functional medicine plans are. There, and these are super related to the underlying science and the natural history of these different conditions. We can be very proactive tactically and strategically about where things are going to drift after the worst of the storm is over. It's just so elegant what you're describing.
Well, there's also a really opportune moment. Let's, for example, say we have a breast cancer patient who has finished treatment, has had successful treatment, but is significantly overweight and is pre-diabetic, has metabolic syndrome. So that overweight and that metabolic syndrome, pre-diabetic physiology, is high risk for recurrence. So there's a moment there where the patient's highly motivated to work on their health, and where they might not have been before. But, you know, always say, I never want to have that cancer conversation with you again. I don't want to have the chemo or surgery conversation with you again. So how do we not go there? And so then we can step in and say, okay, let's take a year and lose this weight. You know, we can lose 1 pound a week, you know, and just make it doable for the patient. We can lower your carbs and teach you how to monitor this. And, you know, these sorts of things, when you feel better as a patient, are self-reinforcing for the most part. So that's where my nutritionist also comes in, because habit change is hard. And so people really need to have some hand holding to implement and stick with those things.
I rely heavily on some of those resources too. Do you want to share with us whether there's a role for intermittent fasting?
Oh, yes. There's a lot of research on that, actually. One of the great researchers is Dr. Walter Longo, who happens to be here in Los Angeles and as the head of the gerontology research department at USC. And for patients, he's got YouTube videos all over the place, and he has talks for patients as well as physicians. And he did a lot of the research on intermittent fasting and cancer, but there's a large body of research in Europe on this as well. And so there's research that shows, there was a study, for example, on over 3,000 breast cancer patients over a 5-year period. And they were asked to fast for 13 hours for every 24-hour period. And the patients who practiced intermittent fasting had a dramatically lower rate of recurrence than the patients who didn't do that. It was also discovered in that study that 13 hours is the magic amount of hours. You have to at least go 13 hours. And so that's really very doable. So I encourage people to do that as a lifestyle thing, so that, you know, between tonight's dinner and tomorrow's breakfast, you have 13 hours. And so that's not hard to do if you can continue that long term. And so I encourage patients to do that. And so that decreases that insulin signal, that decreases the glucose, the blood sugar, but it also turns a switch in the immune system and makes the immune system much more robust. And it also allows us, our body, to go into more of a detox physiology and a repair physiology. And, you know, as humans in our evolution, there were no 24/7 stores. So our bodies are actually geared to have periods where we don't eat. And so you want to stay hydrated. And then if you're on medication, or if you have any metabolic disorders, you know, you have to be supervised to do that safely. But most people can do it, you know, most people can do it. And so I think it's one of the big levers. Eating a low carb diet, doing intermittent fasting are very powerful, and that they don't cost money to do that, you know, and so that's important.
It's wonderful, isn't it?
Yeah, yeah.
How about vitamin D, Dr. Chilkov? What's its role?
Vitamin D is really interesting. You know, it has multiple roles in cancer. Now, some cancers have a viral origin. We know vitamin D helps our immune system to respond to viruses, so it's important when you have a viral pandemic. Also, we know that vitamin D supports bone health. So in patients who have cancers that metastasize and travel to the bone and establish new condominiums in your bone, then we want to keep the bone having as much integrity as possible. And the age demographic of cancer patients is losing calcium from the bone after 50, both men and women. And so we want to keep the bones healthy, primarily for that invasion of the bone by tumor cells. Vitamin D has an immune modulating effect on cancer. It also has an effect on what we call adhesion, which is the ability of cancer cells to stick together and form a tumor mass. So it makes them less sticky in that way. And the more sticky the cells are, the more invasive they are as well, and can burst through into the bloodstream and then travel. And that's really what you want to avoid. You want the cancer to stay in its primary site, because most people never die of their primary tumor. People die of metastatic disease that invaded a vital organ, like the lungs or the brain or the bone marrow or the liver. That's what is life-threatening. So people can live a long time with cancer if it never invades a vital organ. Certainly burdens the immune system. It certainly makes you feel lousy. But if you are doing things like optimizing your vitamin D, then you will have a more robust immune system to do that. And you'll have less invasiveness of the disease. You'll have tumors that can't grow as aggressively. So, you know, vitamin D, the studies, modern studies show, more recent studies show about 75 is an optimal level for a cancer patient. And so that it can only be achieved with oral supplementation. So most of my patients take around 10,000 units, and we monitor their blood to make sure that that's not too much or too little, because everybody metabolizes drugs and vitamins and nutrients differently. And so to measure, you know, I have oncologists say, that's too much vitamin D. You can't give 10,000 units. And I said, I can give it if I'm measuring, right?
Exactly. You know? My practice, exact same way. Yeah. Exact same way as a fat soluble vitamin that equilibrates between the fatty and watery compartments. It equilibrates differently in everyone, and I'm always checking blood levels. So
yeah. And I always tell people, they say, oh, can't you just go in the sun and have your skin make vitamin D? And I always say, well, you'd have to run around the equator naked to get some efficient vitamin D.
So much for that.
Most people, modern life, it's not going to happen, you know.
Yeah, we just narrowed down the number of folks that are going to be able to pull it off that way.
That's right.
How about what would you say are the top 5 most important supplements for preventing or treating cancer, or are they different?
Well, actually, let me just give you my framework, how I build a plan for a patient.
Yeah.
there'll be the first part is kind of the foundation nutrients, and those are mostly the same for most patients, and I'll go through that. And then the second tier is the targeted supplements and nutrients that either will be synergistic with the chemo the person has, or has a particular affinity for those tumor cells. For example, curcumin is synergistic with many chemotherapy agents, also sensitizes radiotherapy. But it also has contraindications in a family of chemotherapy agents. But we use that quite widely because curcumin, which comes from turmeric, is a phytochemical that interacts with over 100 genes and receptors that influence tumor cell behavior. And it is quite safe to take for long periods of time. If there was a drug like that, it would be a blockbuster drug. And so that's one of our tools. You kind of can't talk about cancer without talking about curcumin. Resveratrol is another example of a targeted phytochemical that comes from dark purple and red grape seeds and skins, and a little bit in cranberries, a little bit in blueberries, but mostly in grapes. And that also interacts with over 50 different receptors and genes that influence tumor cell behavior. We also know both of those are anti-inflammatory. We also know both of those decrease blood clotting. So 40% of cancer patients develop a life-threatening blood clot. And so the oncologist knows that, but does not screen for it, does not treat for it. They wait for the patient to have an event, and those events are life-threatening. So I don't wait. I monitor the clotting factors, and I can use things like resveratrol, curcumin, and omega-3 fatty acids, the fish oils, EPA, DHA fish oils, to keep the patient away from that clotting threshold and keep them much safer, and at the same time signal inhibition of the tumor. So the top part is what I kind of call the foundation 5 or foundation 6 supplements. So a good multi that has methylated B vitamins and is free of iron and copper and boron, and also vitamin E tocopherol. So let me explain that. So we want to have, a wide spectrum of nutrients so we can metabolize drugs and detoxify and all of that, and just have our basic functions be optimized. But cancer cells utilize copper and iron for their own growth and metabolism, and so we restrict those. And of course, iron is very pro-oxidative, and really, unless you have lost blood or you're a menstruating woman, you really don't need extra iron, unless maybe you had a surgery and you lost blood or an accident and then you want to replace it. So we want iron to be normal, not abnormal. But those minerals should be in the lowest quartile of normal, basically. And then you have healthy function without extra supply for the tumor cells. And boron has an impact on estrogen receptor positive cancers. And so I look for supplements that are free of that. And then more recent research has shown that tocotrienols in the vitamin E family actually have much more cancer inhibition effect, while tocopherols can actually have a promotion effect. So there are now supplements that have tocotrienols in the vitamin E slot instead of tocopherols. And so there's a handful of companies that make these type of multivitamins. And so there's your multi-appropriate to a cancer patient or a cancer survivor. We want to put in vitamin C with bioflavonoids. We want to put in omega-3 fatty acids, the EPA, DHA, omega-3 fish oils. And we want to put in a probiotic. We want to make sure there's prebiotic fibers in the diet. And vitamin D. So that's kind of your basis. Then most cancer patients, most therapies cancer patients receive deplete magnesium. So I'll put in magnesium glycinate so we get buildup of tissue stores. And then if we have a postmenopausal woman, I'll put in a bone mineral formula to prevent osteoporosis. And many, many bone formulas have copper in them, for good reason. Copper is great for connective tissue, but we don't want to have copper in the supplements of cancer patients. So there are a couple of bone formulas with no copper in them. And so we'll look for those. And so that kind of covers your bases for optimizing normal physiology. And then we'll look at, is the patient in a state where their blood's too sticky, it's clotting too much? What do we need to do about that? Maybe we'll just raise the omega-3 fatty acids in that patient. Maybe that's enough. And we're going to put a little curcumin in there too. But then, for example, we know that ginkgo is very active in ovarian cancer, so then I might put that in. And so that second, more targeted tier of the plan is about the tumor type, the treatment type, what's happening in the cancer terrain, what's unique to that patient. Most patients who are have had chemo have their bone marrow, the factory where blood cells are made, depressed. And so there's some wonderful traditional Chinese formulas, modern Chinese formulas designed for chemotherapy patients to build up their bone marrow and their cell counts again. So that's what goes in that second tier. And so things, the typical things there, we mentioned curcumin, we mentioned resveratrol, we can mention EGCG from green tea, and we could also mention boswellia, for example. Boswellia is fantastic as an anti-inflammatory, especially for colorectal and digestive cancers, but also for brain cancers because it crosses the blood-brain barrier. And so things that enter the brain include resveratrol and curcumin and boswellia. So we want to think about if we need that. What's really interesting is, we think that cancer patients have changes in memory and cognition and executive function because of their treatment, but actually cancer itself causes cognitive change in patients. And sometimes that's an early sign. So what are early signs if you're in general practice and you are looking for red flags, So one is hypercoagulation. If you see D-dimer and fibrinogen go up, or your proton changes in a direction of clotting. So we can monitor those things in patients. That is an early sign that there may be microscopic cancer cell activity. Sometimes you'll see copper and ceruloplasmin, the copper storage molecule, go up. You'll see ferritin go up, and CRP, all these inflammatory markers go up, and they kind of go up together, right? And so we can watch that. And patients who have not solid tumors, but hematologic tumors of the blood cells, then you might see really odd populations of red and white cells. And so the bone marrow is getting crowded out by the disease cells, the tumor cells there, or the cancer cells there. So a general practitioner, I feel, should know the early signs. Of course, fatigue, bleeding are signs, but cognitive change could be a sign also, because the enzymes that are put out by the tumor cells, the matrix metalloproteinases, damage the blood-brain barrier. And so it's flooded with inflammatory molecules. And so you'll see this sort of combination of changes in the blood and change in these symptoms. They come together, and so they form a pattern. And that's really the art of medicine, is to see those patterns, right?
This is such a tour de force through so many important concepts. I'm really happy for our listeners that they get the blessing of hearing the distillation of what you know and do. I know that one of the things we definitely need to talk about, if you still have some more time, is exercise and stress management.
Sure, let's talk about all of that. It's really important. So we know that cancer is stressful, period. And there's an interesting framework for thinking about the stress of cancer patients. And this comes from a wonderful therapist at the UCLA Simsman Integrative Cancer Center. And she introduced this idea that cancer patients are really like PTSD patients, post-traumatic stress patients. They have multiple stressors. Through the diagnosis is the first stress, then the surgery or the chemo or all the invasive tests or the biopsy. Like there's like one trauma after another. And recurrence is another trauma. So I think that's a very compassionate way to think about cancer patients' experience, that they're really traumatized and may continue to be traumatized, and help them to be resilient. I think resilience is a big, important word in life, but it's, some people are more resilient than others, and so we have to really help people develop that. And I think that, resilience is about how you live, and so that's where a coach comes in also. And I always say to patients, having a cancer diagnosis is an amazing opportunity. It's like a big gateway in your life where you get to reflect on a lot of things. You get to reflect on what's important to you, what your real priorities are. You get to reflect if you want to stay in certain toxic relationships or not. You get to reflect on your work, what you spend your time doing, and how you care for yourself, how you interact with others. I mean, it's an amazing opportunity. It doesn't really come in adult life in such a compact way. So I watch people make huge changes in their lives and in themselves, and encourage people to think about it, to say, okay, this is an opportunity, and it's not just stress, it's not just suffering. And so I think we can help patients reframe the experience as an opportunity to change and transform. And then there are those patients who say, cancer is the best thing that ever happened to me, which is totally paradoxical, right?
Yeah.
But that means they did that. They used it to change themselves and change their lives and change their perspective. And so I think that really helps patients to turn the energy of stress into something life-giving, something transformative. And so I encourage patients to think of it that way. And then I have a bias towards meditation and yoga and qigong and tai chi and things like that, because there's also a lot of research on all those things, and there's a lot of research on sleep and on exercise. So patients need to get 7 to 9 hours of sleep. They need to pick the way they're going to manage their stress, whether that's prayer or time in nature or breathing practices or tai chi or, forest bathing, whatever it is for each person. Maybe doing art, something that puts you in the at-rest parasympathetic side of your nervous system. You get good at how to get there. So if you get wound up and re-stimulated, you know how to unwind and relax and calm yourself and sort of self-regulate or know how to ask for help or comfort or reassurance, So I think that's part of self-care, And the research on sleep and immunity, sleep and cancer is pretty definitive. So shoot for 7 to 9 hours, but cancer patients often have disrupted sleep, for lots of reasons: pain, anxiety, hot flashes, what's happening tomorrow. So fear of recurrence. So, we have to see what it is that's disrupting their sleep and help them deal with that. And then exercise. The research on exercise is very compelling, but you don't have to be an athlete. You don't have to be macho. The research shows a minimum of 30 minutes, like a moderate walk, 30 minutes, 5 days a week, changes your risk of recurrence in most cancers. So that's huge.
That's doable. Well, I'm sure folks are taking this all in, and then they're thinking, okay, so if I do Dr. Chilkov's OutSmart system, what are first steps? How would I enter this?
Yeah, so those are big, important questions. So there's a couple of doorways into, taking ththose steps, understanding what they are. One is I have a website with a ton of free information, and that's Integrative Cancer Answers with an S, integrativecanteranswers.com. And there's recipes, there's things about your cosmetics, there's things about stress, there's things about making your home toxin-free, lots of things like that, what questions to ask your oncologist. And there's downloadable PDFs on that for every stage of the cancer journey, like what do you need to be focused on when you're just diagnosed? What do you need to be focused on when you are in recovery or in treatment? So those are all free. And we actually have a special gift for all of your listeners, and I'll give you the link to that is integrativecanteranswers.com/seaworthy.
Thank you.
your universe there. And integrativecanceranswers.com/seaworthy. And what you get with that is you get a food shopping list. You get 2 recipes for therapeutic shakes, because cancer patients are at risk for losing muscle mass. And so you have to keep your protein intake up. And a lot of cancer patients aren't that interested in food. So we have insurance plans for that. And then also I have different combinations of supplements that I recommend at these different stages of the cancer journey. So I have a list of what supplements should you take when you're just diagnosed, what supplements can you take while you're in treatment, which ones do you take when you're in recovery, and which ones do you take if you're in remission and you're healthy and you want to just, you know, optimize your physiology, and then which supplements would you take if you have cancer as a chronic illness. So that's a patient with stage 3 or 4 cancer that has low tumor burden, but it's not gone and they still are dealing with it and may deal with it for decades. And so all that information is in the gift that we have for you. So if you go to that link, integrativecanceranswers.com/seaworthy, then you will get that delivered to your inbox. And you can also read my book, 32 Ways to Outsmart Cancer, which has 32 more things you could do. So, so, you know, you can take a lot of steps and kind of enter this framework and this point of view from, you know, a lot of different angles. But most people really ask, what supplements should I take and what should I eat? So all of those things are you get the beginner's knowledge of them.
Wonderful. I should add that also you train practitioners, so people may be finding out if somebody near them has been trained by you. And unless I'm interpreting it incorrectly, are people still able to establish care with you to work remotely, or is your practice full?
Well, my practice has a waiting list, but we take new patients.
Yeah.
And we're careful of the patients we take, because I ask patients to do really hard things. Mm-hmm. And so if that's how you get to be an outlier, that you have to be willing to change and willing to really engage at a high level, because you have to meet cancer with enough energy to, you know, turn it in another direction. So I do take patients. My clinic website is just my name, NaliniChilkov.com. And if you go there, you can learn about the services we have at our clinic. And then I have an online training for clinicians, not to treat cancer, but to do this OutSmart Cancer system, so you can support patients at risk, patients in treatment, patients in recovery, patients in remission. So, you know, if somebody comes into your practice who says, I'm a breast cancer survivor and I had chemo and I'm on hormone therapy and I'm exhausted, you don't think thyroid is the first thing. You think about their history and know how to approach that patient with a cancer history like that. And so, and then we have live mentoring also, where we get to have these conversations. We do that once a month, because that's how I really learned. I had an amazing mentor. And so that's how I came to a place where I thought I knew what I was doing at some point.
Well, Invoking Mentors, you might be interested to know that my mentor of 17 years is a brilliant Chinese medicine acupuncturist, ND trained at Bastyr, Hilary Daly.
Wow.
And so,
wow, I don't know her.
So
beautiful.
That seems to be a recurrent motif of blessings in my mentoring that's recurring today. So I'm very grateful for that.
Yeah. We all need our elders and our mentors. We definitely do.
It's so neat to me how that imprints our approach, and we'll sometimes cycle back and think 5, 10, 15 years into our practice, this is the imprint of my mentor. They'd be really proud in this moment to know that I invoked the tool that they recommended or built in a certain way.
Yes. I have students that present me cases, and there they are using my system. I go, oh my God, I learned how to teach it. And other patients are getting touched by it. So it's very, very enlivening.
That's a pretty great moment, isn't it?
Yeah.
Are there closing thoughts you'd like to share?
I think the most important thing for someone who is dealing with cancer, or who's at risk or recovering from any stage of the cancer journey, or a family member, is you just got to know you can take control of it. You absolutely can take control of this and turn it in another direction and build health and really understand how to monitor yourself and the things in your lifestyle that are big levers. You can take control of it. That's my big message to patients is, you're not hearing that from your oncologist, but that's what you need as a patient, is to know what are the behaviors, what are the lifestyles, what are the foods, what are the basic vitamins, what are the ways to care for myself that will lower my risk and give me a super good quality of life and make me less anxious, So that's my big message, is you can take control of it.
Yeah. Well, I'm so glad that you exist and you ease people's suffering and you help them be healthy. It's just really good news. And what a blessing to get to talk to you today, Randy.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.